Physical development. The physical development of an infant gives them the abilities that they need to explore and interact with the world around them. The physical growth of an infant starts when their muscles gain strength and then gradually developing their coordination. Language development. The language development of an infant is the development of starting to understand certain words and noises that they hear, responding to their own name, being called, and the ability for them to start putting words and sentences together. Cognitive development. The cognitive development of an infant is based on his or her brain development, which includes their ability to remember things and people, their ability to problem solve when using certain toys and objects, and their decision making. Infants are an offspring, often called baby, between the ages of 1 month to 12 months. Physical development. In their first month of development, they can move their heads from side to side while laying down on their stomachs. Develop a strong grip onto things, hair, keys, plush toys, etc. Begins to build the strength to lift their heads up. Are able to open and close their hands. In the 3rd month of their physical development, they can reach for and grab objects that they want. Language. In the 1st month of development, they begin to stare at their hands and observe the way their fingers move. They begin to play with their fingers. In the 3rd month of development, they begin to make cooing sounds, cries as their way of communication, mimic facial expressions, and are calmed by the sounds of their parents' voices. Social emotional. In the 1st month of development, they are able to track movements with their eyes of the people that they are familiar with. They begin to respond to individuals by smiling when they see somebody or when somebody is talking to them. In the 3rd month of development, they begin to mimic people who make faces. For example, sticking out their tongue at the infant, they will copy them. Physical. By the 4-month stage of development, infants are now able to lift themselves up using their arms when they are laying on their stomachs. They begin to roll on their tummies from one direction to the other direction. They are also able to keep their heads up in place without the help of anybody. They can grab a toy they want to play with and shake the toy. Learning to transfer toys from one hand to the other hand. Language. They begin to laugh and giggle. They begin babbling as their own form of communication. They will cry in different ways to differentiate between their hunger, their pain, etc. Are now blowing spit bubbles, babbles as their way of talking. Social emotional. They enjoy the idea of play at this time and may cry if the playing stops. They are starting to reach for their moms and dads. They may cry if they do not see their moms and dads in sight. They recognize other familiar faces, such as family members, caregivers, family friends, other children, etc. They respond to other people's emotions. For example, if they hear another baby crying, they begin to cry. They enjoy looking at themselves in the mirror. Cognitive. They begin to examine things that are nearby. They show curiosity about things. For example, something that their parents are holding, that an animal is wearing like their collar. Language. Babbles in a more confident way, thinking people can understand them. They are responding to people by looking at them when they have heard their name being called. They respond to familiar words that they hear. This is the stage of development that the infant learns object permanence.
You say hi to your daddy. Well, what were you saying earlier to make him talk? Slap, slap, slap. Clap, clap, clap. Slap, slap, slap. Clap, clap, clap.
Social emotional. They begin to respond to others' emotions. They start to play interactive games with others. Example, peekaboo. They are beginning to develop anxiety when they do not recognize a person holding them or looking after them. They are clingy with people that they are familiar with. They are able to identify their favorite toys. Cognitive. They start to look for things that they know an individual has hidden. They can move things smoothly from one hand to another hand. Physical. They are now starting to pull up to stand. They are starting to use furniture to walk around on their own around the room. By the end of infancy, they are starting to stand by themselves and make their first few steps. Language. They respond and understand simple requests. Uses simple gestures. Example, waving goodbye, shaking their head. They say things like mama, dada, or uh-oh. They lift their arms to communicate when they want to get up. By the end of infancy, they can sometimes say about 2 to 3 words. Social emotional. They are now starting to test their parents' reactions. At dinner time, pushing away their food or throwing their spoon on the floor. They play games like pretending to use objects as a telephone. They can be shy or nervous with strangers. Hands their parents a book when they want them to read them a story. They put out their arms or legs to assist with getting them dressed. Cognitive. Finds hidden things easily. Copies people's gestures. Pokes with their index, pointer fingers. Follow simple directions such as pick up a toy. Are able to look at the right picture when it is named.
Yeah. Say bye. Bye.